This video is for educational purposes only and is not medical advice. Always consult your healthcare provider or pharmacist before making decisions about your medications. On July 16, 2026, just a few days ago, the FDA approved a new cholesterol medication that people in cardiology have been waiting on for years. It's called Lipfendra. The generic name is Invasive. It's made by Merck. Here's what makes it significant in one sentence. It's the first oral pill that works like the most powerful cholesterol injections on the market. To understand why that matters, you need to understand what's already available and what gap this fills. There are three main classes of cholesterol medication already available. First, statins. Lipitor, Crestor, Zocker, the standard first-line treatment for decades. They work by blocking the enzyme your liver uses to make cholesterol. Effective, reducing LDL by 30 to 55%. Oral pills, widely used and well understood. Second, ezetimibe. Brand name Zesha. Works differently, it blocks cholesterol absorption in the gut rather than production in the liver. Adds about 18 to 25% further LDL reduction on top of statins. Also an oral pill, often used as add-on therapy. Third, injectable PCSK9 inhibitors. Repatha from Amgen and Praluent from Regeneron and Sanofi. These are the most powerful LDL-lowering medications currently available, reducing LDL by 50 to 60% on top of statins. They also have proven cardiovascular outcomes data, clinical trials showing they actually reduce heart attacks and strokes, not just lower a number. The problem? They are injections, every 2 to 4 weeks. For some patients, that's manageable. For many others, the injection barrier is why they never start or don't stay on the most effective treatment available for their cholesterol. That's the gap Lipfendra fills. To understand what Lipfendra does, you need to understand PCSK9. Step 1. Normally, PCSK9 destroys LDL receptors. Your liver uses LDL receptors to pull LDL cholesterol out of your bloodstream. PCSK9 is a protein that binds to these receptors and marks them for destruction. More PCSK9 activity means fewer LDL receptors, which means less LDL gets cleared from your blood, and levels rise. Step 2. Lipfendra blocks PCSK9. Enlicitide is a macrocyclic peptide, a small, ring-shaped protein molecule engineered to bind directly to PCSK9 and prevent it from attaching to LDL receptors. With PCSK9 blocked, the receptors survive. They keep doing their job, pulling LDL out of the bloodstream. Step 3. LDL drops significantly in 2 large phase 3 trials, called CORA-L-REEF lipids and CORA-L-REEF EFH, involving over 200 adults already on maximally tolerated statin therapy. Lipfendra reduced LDL by 56% and 59% respectively versus placebo. It also reduced other atherogenic lipoproteins, non-HDL cholesterol, and ApoB, which are associated with cardiovascular disease risk. And the reason this can now be a pill. Previous PCSK9 inhibitors are large monoclonal antibody proteins, too large to survive the digestive process and be absorbed. They have to be injected directly into the bloodstream. Enlicitide is a macrocyclic peptide, a fundamentally different type of molecule. Small enough and stable enough to be taken orally and absorbed through the gut. That's the engineering breakthrough that makes Lipfendra possible. The comparison table on this slide tells the story clearly, but let me walk through the most important rows. Mechanism. Statins and Lipfendra work by different pathways. Statins block cholesterol production in the liver. Lipfendra, like Repatha and Praluent, blocks PCSK9 to preserve LDL receptors. Form. Statins are oral pills. Repatha and Praluent are injections every 2 to 4 weeks. Lipfendra is a once-daily oral pill. That's the headline. LDL reduction. Statins reduce LDL 30 to 55%. Lipfendra and the injectables both achieve 50 to 60% reduction on top of statins, comparable efficacy in different forms. Side effects. In phase 3 trials, Lipfendra's side effect profile was similar to placebo, well tolerated in both trials. No significant safety signals. Now, the most important row on the table, cardiovascular outcomes. Repatha and Praluent have proven in clinical trials that they reduce heart attacks, strokes, and cardiovascular death, not just the LDL number. Lipfendra does not yet have that data. It's approved for lowering LDL. A large outcomes trial with over 1,400 patients is currently underway. Experts expect it will show the same cardiovascular benefit because the mechanism is the same and LDL lowering is well established as protective. But the data isn't in yet. That distinction matters when having a conversation with your doctor about which treatment is right for you. Who is this for? Adults with LDL that remains too high despite maximum statin therapy. Patients with heterozygous familial hypercholesterolemia, a genetic condition that causes very high cholesterol from birth that often can't be controlled with statins alone. Patients who need PCSK9 level reduction but can't or won't use an injection. The convenience advantage is real. For patients who need repatha-level LDL reduction but avoid it because of injections, Lipfendra is a meaningful option. A once-daily pill is significantly easier for most patients to sustain than a biweekly or monthly injection. Better adherence to treatment is clinically significant. A drug only works if patients actually take it. The honest caveat: if you currently need cardiovascular protection, if you've had a heart attack or stroke, or are at very high risk, and a PCSK9 inhibitor is recommended, the injectable options have the proven outcomes data today. Lipfendra is expected to show the same benefit when the trial reports. But if your doctor is weighing the clinical evidence right now, that's an important part of the conversation. This is a genuinely exciting development. The combination of PCSK9 level efficacy with the convenience of a daily pill addresses one of the most significant barriers to optimal cholesterol management. If your LDL isn't where it needs to be on your current medications, or if you've been avoiding an injection, this is worth bringing up at your next appointment. Subscribe for more plain language breakdowns of the medications and medical news that actually matter. The AI Pharmacist at the AI Pharmacist Video 30. Lipfendra, July 2026.